So, you're about to start your PEDS rotation, and you already know that vaccinations are a massive part of the job. But it's so much more than just a quick poke, right? It's about the science, it's about safety, and it's really about building trust. Think of this as your go-to guide for mastering one of the most vital skills you'll use.
Okay, so here's our game plan. We're going to break this down just like you'd experience it on the floor. First, we'll talk about your role. Then we'll walk through that all-important pre-vaccination checklist, the actual administration, the key vaccines you'll see all the time, and finally, what happens after the shot is done.
All right, first things first, your role. And let's be super clear about this. You're not just a person who gives a shot. You're a critical thinker. Your job starts with assessing the patient, then it moves to educating the parents, and it ends with a safe, skilled administration. So let's really put that nursing hat on for a second. What are you actually responsible for before you even pick up a syringe, during the actual injection, and then after the family leaves? Thinking through this whole process, from start to finish, is what's going to guarantee the best, safest outcomes for your patients. Okay, now let's get into the nitty-gritty, starting with those critical steps you absolutely have to take before that needle even comes out of the cap. Seriously, think of this as your pre-flight check. It is completely non-negotiable. This pretty much breaks down your pre-vaccine workflow into 4 essential steps. First, you screen the patient for any reason you might need to delay. Then, you educate the parents, usually with the vaccine information statement. Next, you get that signed consent. And finally, you document every little detail, the lot number, the expiration date, where you gave the shot, the whole shebang.
You know, a huge part of that screening really comes down to your clinical judgment. So, what do you do if a kid has a cold? Well, the rule of thumb is pretty straightforward. Mild stuff, like a runny nose or some sneezing, totally fine. But if there's a fever or they're dealing with a more serious illness, you delay the vaccine. We do that because we want their immune system to be 100% focused on the vaccine, and we don't want to get symptoms of their illness confused with vaccine side effects.
All right, so you've done all your safety checks. Now it's time for the procedure itself. And this part is all about combining really precise technique with compassionate comfort measures. Because believe me, how you give the shot is just as important as what you're giving.
Now, this is so important. You've got to pick the right spot for the right age. For infants, we always go for the vastus lateralis. That's that big, meaty muscle on their thigh. It's well developed and it's safely away from any major nerves. Once kids get a bit older, we typically switch to the deltoid muscle in the arm. And please, never ever underestimate the power of comfort. Distraction is your absolute best friend here. A video on mom's phone or a shiny sticker can work wonders.
And this right here, it's such a brilliant, practical way to handle things. A child who's moving around a lot is a safety risk, plain and simple. Having a parent hold them in a secure hug on their lap isn't just about keeping them still. It's about making them feel as safe as possible while you get the injection done safely and accurately.
Okay, let's get into the vaccines themselves. And listen, you do not need to have the entire CDC schedule memorized. The goal here is just for you to get comfortable with the what and the why behind the most common vaccines you'll be giving day in and day out.
Let's start with the little ones, the infant and toddler series. This is all about building that foundational immunity against some really nasty diseases, right from the get-go when they are most vulnerable. This table gives you the rundown of the heavy hitters for infants. First up is DTaP. That's for diphtheria, tetanus, and pertussis, whooping cough. Then you've got Hib, which protects against the bacteria that can cause meningitis. Same with PCV13, which prevents pneumococcal disease, another major cause of meningitis and ear infections. And of course, there's the polio vaccine, or IPV, which is an inactivated virus that protects against that awful disease.
Now, for one that's a little bit different, while almost all the other vaccines are shots, the rotavirus vaccine is unique. It's designed to prevent that severe diarrhea and dehydration that can be incredibly dangerous for babies.
And you can see how it works right here. It's actually an oral liquid. The baby just swallows it. Now, the most important thing to remember about this one is that it is a live vaccine. That means it contains a weakened but still living virus. Because of that, it's a no-go for any patient who is immunocompromised, which makes that screening question absolutely critical.
Okay, let's talk about these next two together. It's just easier to remember them as a pair. So we've got the MMR for measles, mumps, and rubella, and the varicella vaccine for chickenpox. They're similar in a few key ways. First, they are both live vaccines. Second, they're both given subcutaneously, not IM like the others we just talked about. And third, they follow a very similar schedule. First dose around 12 months, and the second dose between 4 and 6 years old. All right, let's fast forward a bit to the preteen years. The vaccine needs start to change as kids get older. The series is all about boosting that earlier immunity and protecting them against new risks that kind of come with being a teenager.
So, right around age 11 or 12, 3 really important vaccines come into play. First is Tdap, which is a booster for tetanus, diphtheria, and especially pertussis, since that childhood immunity can start to fade. Next is the meningococcal vaccine, which is so important for preventing a type of meningitis that can spread like wildfire in places like college dorms, which is why so many colleges require it. And finally, the HPV vaccine, which is a total game changer. It's literally a cancer prevention vaccine. One key tip for you as a nurse, fainting can be a side effect with this one, so you'll want to have your patients sit and chill for about 15 minutes after the shot, just to be safe.
Okay, the injection is done. You'd think you're finished, right? Nope, your job is not over yet. This final phase is just as crucial. It's all about giving parents clear instructions, knowing what to expect, and understanding your role in the bigger picture of public health.
Honestly, one of your most important jobs right now is educating the parents. You have to be super clear about what's normal and what's not. It's totally normal to have a low-grade fever, some soreness, maybe a little redness. They can manage that with some acetaminophen. But a red flag, something that needs to be reported, is a severe and unexpected reaction, like a seizure.
And it's rare, but if one of those red flags does happen, you need to know exactly what to do. Any severe or unexpected adverse effect has to be reported to the CDC's Vaccine Adverse Event Reporting System, or VAES. It's a vital part of your job, and it's how we help keep vaccines safe for everybody.
So look, we've covered all the techniques, the schedules, the safety checks, but at the end of the day, it all really boils down to this. The procedure is a science, sure, but the delivery, that's an art. It's your calm confidence, your clear communication, and your compassion that actually builds the trust that makes all of this life-saving work possible. Don't forget that when you step onto that floor.